Hello. I'm going to tell you about my jaw surgery, which is happening in June, in 3 months' time. I am having the jaw surgery to correct my overbite and my overjet. So my teeth, instead of being like this, will be like this. And it'll be nice and straight. My profile will be really pleasing. I basically have a severely tiny jaw, which I was only told after enduring millions of braces during my teens. I went back to them when I was about 20. I'm now 22, and I told them that my teeth had moved again, and I just wanted them to stop moving around, because what's the point otherwise? I mean, you know, you can have those bars put behind your teeth to keep them straight sometimes. They said that yes, I had a severely tiny jaw and I needed surgery, orthognathic surgery on my lower jaw. Turns out I need it on my lower and upper jaw, and perhaps have my chin shaved off a little bit, because they're going to move it forward, take a slice of bone out of here, because when I smile it's very gummy. That seems cosmetic, but it's part of the procedure and it's all going to fit in nicely like a jigsaw puzzle at the end. Yeah, so they're going to move it forward and up, and if my chin pokes out they're going to slice a bit of chin off. So this is what's going to be done in June. I've had my brace on for a year now, since last Easter, and it's been okay. I mean, my teeth didn't need much moving. There were only about 2 or 3 teeth out of place, drastically. So I've been to the hospital lots to have lots of new wires put on. Then in June I come home from uni where I've done all my exams, and they're going to take some final molds of my teeth, and they'll give me a pre-op assessment and everything like that, and then I will go into hospital on a Friday, I believe, and then I will stay in for 3 nights, 4 days, I think. And they've told me, they've been very frank about it, and I do appreciate it. They told me it's going to be awful, and I'm going to feel very depressed on the Saturday, I think, and I'm going to hate it, and I'll see no end to it apparently. But I think I'll try and be as positive as possible. I know I've got mum and dad on hand with a syringe full of processed food. Yeah, all of the food I'm going to be eating after I've had the surgery, because all my teeth will be wired together. It'll have to be syringed in through my teeth. The syringe will have a big rubber straw kind of thing, pipe tube coming out of it that I'll have to just kind of post through there. So yeah, soft food for a month. Gradually I think they'll loosen and let me open my mouth a bit further. They'll check how it's going, and then eventually it'll all be fine, but my brace will still be on. Unfortunately they can't take that off until they've made sure that the teeth are in the right place and they're all fitting together. And but yeah, I'm actually really excited about it, because I know that I never really understood that I had this problem, but once you find out about it, you are highly aware of it, and I've become quite self-conscious about it, actually, in a strange way. It's not bad, it's just that I know that my jaw is just not there, and also that my teeth don't really meet properly at all. When I'm eating like a pizza, if it's a bit chewy, it's a bit of a nightmare, and I'm very slow at eating, and as I was only aware of as of yesterday, I can't actually close my lips without consciously doing it. You know, if you close your mouth, most people's lips just close like that, but that's as close as mine get to it. I had pictures taken yesterday. One thing that's really interesting about modern day orthognathic surgery is that they're going to take pictures of my skull, which they've done. They've taken the x-rays yesterday, and then they're going to take pictures of my face. That's also been done, and then they're going to somehow show me what I'll look like afterwards by doing some kind of manipulation, computery type thing, which is really nice because in the past, apparently my mum was told that she needed the same surgery, so it's obviously genetics, this whole painful procedure. She was told when she was 14, so that would have been 1980, no, 19, oh my god, I'm so bad at maths, 19, or like in the 60s, anyway, 60s, early 70s, that she needed it, but obviously she didn't. She was told that she'd look totally different, and I mean, maybe, but totally, it's not going to be that bad. I mean, I'll look the same from the front, I just won't look the same from the side. But yeah, so it's really good that I have that advantage, and I'll be able to see what happens in the end. I'm not scared, really. I'm more excited. I want to get it over with. But if there's anyone who's thinking of having the same surgery, especially people who have overbites rather than underbites, because I don't really understand. No, I don't know anyone who's had that, but then I'll tell you everything I can. The surgery will be happening in June, so there'll probably be another video then when I'm looking frightened, and then another one when I'm actually, by the miracle that is a tiny weeny chainsaw, had my jaw moved forward. I'm actually more freaked out by the whole slice of bone out of here thing. I think that's quite horrible, but whatever. They were talking about my nose as well and how that might move and how I've got a really wonky septum. I was never aware of that before either. I thought I was fine, but no. So yeah, I'm really excited about it, and I'm really excited about the end result. Yeah, so ask me any questions if you fancy it, and I'll see you in June.